Growing public support for health care programs helped the Democratic Party win control of the U.S. House of Representatives in the 2018 election, and advocates believe it will also help the party nominee in 2020.
Healthcare is a winning issue for Democrats. So I think any way that they focus on healthcare and solutions is going to be beneficial to them.
Republicans have had to fend off criticism that conservative efforts to cut government funding would deny care to many in need.
No one's trying to deny the sick health care. I think that's an important thing to clarify. What's important is how we achieve that.
The rising cost of health care continues to be a major concern in the U.S. Senator Bernie Sanders, who lost the Democratic presidential nomination in 2016, is again running on a promise to expand the government Medicare program for senior citizens to provide universal health care funded by increased taxes.
The goal of a rational health care system is not to make insurance companies billions in profits and CEO compensation for their executives off the wall.
Other prominent Democrats supporting this expansion are California Senator Kamala Harris and Massachusetts Senator Elizabeth Warren. But there are concerns that proposing a government takeover of the $2.5 trillion health care industry could alienate centrist voters in the general election. More moderate Democratic hopefuls such as Minnesota Senator Amy Klobuchar and former Vice President Joe Biden, who is still considering whether to run, endorse incremental measures like a government public option plan to compete against private insurance companies. But such an approach may alienate the party's progressive base, calling for transformational change. President Donald Trump has criticized Democratic health care proposals as socialist.
Democrat lawmakers are now embracing socialism. They want to replace individual rights with total government domination.
During the 2016 campaign, Trump promised not to cut assistance programs, but in this year's budget, the president proposed reducing funding for both Medicare and Medicaid, which provides medical assistance to the poor and disabled. Brian Padden, VOA News, Washington.